This
For
conference will now be recorded.
thanks everyone for joining us. We have representatives from local hospitals and county public health department here to give an update on the COVID situation here in Clatsop County. So what we normally do is have each of our participants just give a brief opening uh, uh, informational update on what's going on with their particular organization. So why don't we'll first start with uh, Dr. Streer. I think you're new to our news conferences. Maybe introduce yourself and just give a little um, observation on what's happening at CMH. I don't think we can hear you. Can anyone else hear? Your mic is on, but we're not hearing you.
Is this better?
Now we can, yeah.
All right. Sorry about that. My name is Chris Streer. I'm an emergency physician, and for the last 7 months, I've been the chief medical officer here at Columbia Memorial Hospital. I came from Portland, and you wanted, I'm sorry, a brief update or summary of how things are going at Columbia Memorial?
Yeah, if you could.
Okay, sure. So things are going pretty well. We are quite busy with COVID and non-COVID patients. Our COVID census is a little bit higher in general than it has been in the past few weeks, but not yet as high as it was during the surge earlier in the year.
Okay, great. Thanks.
Maybe you could tell them a little bit about what OHSU is predicting.
As far as the surge goes,
Yeah, that probably
sure,
would be useful.
sure, absolutely. So a couple of weeks ago, I believe the head data scientist at OHSU had predicted um, that with the advent of Omicron, the state would see a peak of hospitalizations um, of around 3,100 patients a day, and that compared to 1,200 patients a day during the Delta surge um, earlier in the year. This forecasting was based largely on Denmark, which is similar in population and vaccination rates and other key demographics to Oregon. And based on what they have continued to see in Denmark, most importantly, about a 70% lower hospitalization rate with Omicron than with Delta, OHSU has revised the forecast recently and lowered the number of peak hospitalizations from around 3,100 to around 1,700. And if Oregon continues on an upward trajectory of vaccinations, particularly boosters, and social distancing, limiting indoor activities and mask wearing, that peak could be improved from 1,700 to about 1,250. Our main concern, our main challenge, and this is fantastic news. And as an aside, Omicron is preliminarily looking to be less severe than Delta, fewer hospitalizations, fewer ICU cases, fewer ventilated patients, and shorter hospitalizations. But it is wildly more infectious than Delta. And because of that, even though the surge hopefully won't be a whole lot more in an absolute sense than Delta, we expect there to be uh, fewer healthcare workers to take care of these patients because we expect more healthcare workers to test positive for Omicron, and that'll take them out of the action as far as caring for the patients. So maybe a few more patients, but less care workers to take care of them compared to Delta.
Great. Thanks, Chris. And Jason, what's the update you have from Providence Seaside?
Yeah, thanks, Chris, for that information. Yeah, I think we're going off of that same report that OHSU sent out. Right now, we only have one COVID positive patient in house. We're not seeing a big uptick at this point, but we are kind of bracing for the things that Chris brought up. Our biggest concern is with how contagious this new variant is. We're worried about losing staff. So we're just reinforcing the importance of masking, hand hygiene, and then getting that booster shot. When we were invited to this meeting today, Judy and I were texting back and forth about how the message we wanted to get out to the community is, if you've been vaccinated and you're due for that booster, get that booster, right? Like, it's the most effective way for us to combat this. And then the things that Chris brought up, masking, social distancing, and if we can get our community vaccinated and boosted up, we're going to have a much better chance. But right now, as far as Seaside's doing, knock on wood, I don't want to jinx anything. We're doing really well at this point. We haven't seen a huge uptick, so that's the good news.
Great, thanks, Jason. And then we'll go to Margot. What information do you have from Public Health?
Yeah, good morning, everyone. So a few updates. One, we have been working diligently and in close collaboration with our health and medical partners to continue operations during this inclement weather period. It has affected testing, it has affected staffing at the PIC. We've reassigned staff to make sure there are people to answer phones and to get people tested and prioritize those who need to be tested. We're also really honestly on a daily basis reevaluating based upon changing guidance, expiration dates, availability of either vaccinations or other resources, that collaboration with, again, our health and medical partners to stand up as many clinics as we possibly can, making sure that we're meeting people where we're at. We thought that with the new information about Omicron and this initial surge and burden on the hospitals, that we would need to stand up those really large mass clinics again. And what we're finding is that that's not actually as an effective strategy, and that we're really focusing on what we've already been doing, which is standing up these pocket clinics all over the place and really collaborating and doing that with staffing with both of our hospitals in terms of locations, et cetera, and that messaging. So I think that's going really well. We watch the data closely, and I'm concerned a little bit about our booster rates in our county. They're not as high as I'd like to see them for the 65 plus population. And just the pediatric population, that first and second dose, I'd like to see that a little bit higher. I'm sure there's multiple reasons why that's happening. And, one of my concerns is the talk about that possible third dose for the 5 to 11-year-olds maybe made some people uncomfortable, and especially those who were perhaps a little hesitant and wanting to watch and see what was going to happen with that first and second dose. I think we can expect possibly to see a surge in cases. Our schools are still doing great. I just got some data today about the number of cases from the last report in our schools. And but everyone's been home, and it's been the holidays, and so it's given the schools a break. But also, I think it's prudent for us to expect a little bit of surge in cases. And in fact, that's what we see at the end of every break, just in a routine flu and common cold season, is that kids go home, they come back to school, they bring those respiratory infections, and they're contagious. So we'll be definitely watching for that. Because of the vulnerable populations, particularly in congregate living, we've done 2 rotations of calls to both group homes, foster homes, long-term care facilities, assisted living facilities, to assess the status of their populations, not only the residents, but also the staff. What is their booster status? The overall vaccination rate is very good for our facilities. But again, we're creeping up to get those booster doses to the populations that need them. OHA has a statewide strategy and contractors to bring vaccinations to facilities. And so we've been working with them in terms of actually going out and vaccinating versus us public health doing those vaccinations, because we did it during the initial vaccination campaign. So we're watching that closely, and we have a call today at 11 a.m. with OHA, so we'll get some more updates in that regard as well. And I think that's it for me. Thanks.
Okay, thank you, Margot. I don't know if Judy's still with us, or if you have any additional information to share.
I don't know what's going on with my camera. It says it's on, but it's apparently not. I just would like to reiterate what both Chris and Jason said, is that we are preparing for the surge to come. We're very worried about the staffing piece and the fact that people are just getting tired of having surge after surge of COVID. So hoping that everyone in our community will do their part to try and minimize it as much as absolutely possible.
Okay. Great, thank you. Okay, we'll go to our media. Jacob Lewin, KMUN, do you have any questions for folks?
Oh, I do. Good morning. Well, Chris, how many COVID patients do you have at CMH?
I haven't checked the census this morning, but as of yesterday afternoon, we had 4 COVID patients.
And do you know if they, I'm sorry, go ahead.
Oh, I was going to say, and that's sort of been our high so far in the last several weeks, is 4.
Are they Omicron? Do you know?
Well, probably not. We don't know. For the most part, we don't, when we have a COVID positive patient, we haven't been getting that kind of testing done on everyone, with testing to see what type of strain they have. That's not being done locally. And I don't know if those, at the patient level, I don't know if that data is coming back to us yet or not. But Delta is still the predominant strain locally, and so I'm assuming that our patients are Delta.
Okay. When you talk about possibility of 1,700 statewide or possibly 1,250, up from I think around 400 now, what do you see as the impact on CMH and on Seaside, Providence Seaside, as far as including like the carry-on, the follow-on sort of effects that we've seen in the past, where you want to send someone, stabilize someone here and send them to a Portland hospital? Do you anticipate more problems like that, or are you having any problems right now like that?
That continues to be, at least at CMH, that continues to be a big challenge. And in meetings that I've been on with other CMOs in the region, that is certainly not a unique challenge to our area. The hospitals, especially the tertiary and quaternary centers that we're used to sending our more acute patients to, they're as crowded as ever. And in fact, the current problem with their capacity issues isn't necessarily in new COVID patients. It's a combination of patients whose care was delayed by COVID in the past that are now seeking help, or who couldn't get preventative help in the past, and now their disease processes are out of control, much more severe. They're trying to catch up on the surgical backlogs that those hospitals all have. And there's also a huge challenge for them, because they have a large number of patients that no longer need acute care, but there's no skilled nursing facility or nursing home or assisted living facility for them to discharge to. And so they have a lot of patients that are taking up acute inpatient beds because there's nowhere to send them. Additionally, when we have a patient who has a specific need for a higher level of service, like a patient who's having a heart attack that needs to go straight to the cath lab or is having an acute stroke, we need to send them to a hospital such as OHSU or Providence St. V's for a very specific thing, like an emergent cardiac catheterization. But after that's done, a lot of times the patient is stable enough to come back to our hospitals, but not well enough to be discharged home. But oftentimes, because of payer issues, for instance, the patient can't be transferred back to the hospital from where they came. They can't be transferred back to the hospital in their own community. And they have to stay at these higher level hospitals, taking up their bed space, even though they don't need specifically those higher levels of care that prompted the transfer in the first place. And that's also adding to the capacity issues in downtown hospitals. I anticipate things to continue or possibly be a bit worse when we see the surge in early February that we expect.
I have more questions, but Tom, should I defer to Eric?
Sorry, Jacob, you're kind of breaking up. We can't hear you. Oh, sorry, Jacob, we couldn't hear you on that last question. You were kind of breaking up. Okay, I think we'll go to Eric at the Astorian. Eric, if you have any questions, and we'll come back to Jacob if we can get you connected again.
Yeah, thanks. So will the hospitals continue to provide the antibody treatment, even though the effectiveness against Omicron is limited? I believe that was at the last task force update.
I'm so sorry, I missed a couple words in that, like the nouns. Would you mind repeating that question, please?
Sure, sorry about that. So will the hospitals continue to provide the antibody treatment, even though the effectiveness against Omicron isn't super strong? I think that was mentioned in the last vaccine task force update.
I can certainly start off that answer. So the monoclonal antibody that we were receiving and had been giving at the clinic that was stood up in tremendous collaboration between Providence Seaside and Columbia Memorial and Margot's folks, we're no longer getting shipments of that particular antibody because of the lack of effectiveness against Omicron. Now, again, the folks that we'd be giving them to right now most likely have Delta, and so it still has a good effect. But I think we only have plans for one more clinic. Margot, is that right, Jason? There's another monoclonal antibody that is likely more effective against Omicron, but it can't be given the same way. It has to be given as an infusion through an IV, and so the logistics of setting that up, especially in a joint fashion, is much more complicated. And I don't know if we know collectively, number one, the availability of those antibodies, and number two, the best way to give them. Fortunately, fingers crossed, the FDA has approved an oral antiviral treatment, and at least the Pfizer treatment shows the same or maybe even a little bit better efficacy than the monoclonal antibodies, and that's an oral treatment that patients take at home. There were only 650 courses available to the entire state, but Pfizer is saying that there should be much greater availability starting in the new year, and that's really exciting. And if we have access to those medications, that should that should replace the need for the monoclonal treatments. And Margo, Jason, I don't know if, or Judy, I don't know if you've heard any more about that.
No, that's correct, Dr. Strayer. And, you know, the way the state is receiving its allocation, it's advocating strongly for communities, particularly rural communities. But they do have plans to prioritize. And again, this will be based upon you know, our existing data that we have. And typically when they're they shared last week when there's a national allocation for the country availability, Oregon typically gets 1% to 2% of that allocation, which isn't a whole lot. Again, I expect since our last meeting, there will be updates today in terms of what that will look like. I just don't know. I don't know the details at this point in time. What I do know actually is that we have we've problem solved many things along the way, and I think our collaboration gets stronger and stronger. So based upon what's available to our community, I have no doubt that we'll figure out how to get it to the right people at the right time.
And Jason, Judy, don't know if you have anything to add.
No, I don't.
Yeah, I thought Martin put it well. Yeah.
All right. Eric, any more questions?
Yeah, sorry. So I got one COVID patient at Providence and then 4 at CMH. These are hospitalizations?
Yes.
Yes.
Correct.
Okay. So what are the hospitals doing just in general to prepare for Omicron? Anything special or new or unique?
We haven't done anything special. What we're doing right now is I'm going back and asking our teams, what did we miss the last time we had a big surge that you would have liked to have seen as we cared for the patients, and trying to be prepared in advance. I also have a weekly meeting now with a group of nurses who are part of our staffing committee, just to update them on what's going on, what we're doing for preparations, and getting their insights into what they're worried about as we go back into a surge.
Yeah, we're same thing here at Seaside. We're just going back over what we did to prep the last time, what can we do better this time, you know, and just kind of being at the ready, so to speak, for what comes.
Thank you.
Jacob, do you have any any more questions? I'm not sure if your connection's working. May have lost him. Eric Bengal, do you have any other questions?
I do not.
Okay. Well, unfortunately, I think we've lost Jacob, so I don't know if our participants have any final thoughts or information to share.
I'd just like to piggyback on the hospital's preparation because, yes, I mean, this is definitely an iterative process and response. But I circle back to the importance of communication. So there's telling a story, and then there's providing the right information at the right time for the right reasons. And that's really what the PIC is about. It's the hub. And it continues to operate despite the inclement weather and a very meager staff 5 days a week. And so making sure that they have updated information and it's properly staffed to answer the calls that we receive from the public, which are many, hundreds, well over 100 calls a week. And so, and again, most of the staffing for that are volunteers that have been dedicated time over the last 2 years. And so as much as we're concerned about our staff, we have volunteers that are so absolutely critical to the infrastructure and this whole response, and they're tired as well. And so I just want to continue to recognize that and name that. Thanks.
My audio, I think, is back. I'm very sorry about this. Margot, could you tell me what percentage of people have gotten boosters? And you said over 65, you were disappointed. What sort of numbers are they?
Yeah, so when I was looking at the data yesterday for our boosters, that extra dose, it's about 56, probably close to 57, 58% now for 65 and older, and yet, you know, it was 85.7% when for completing their initial series. And then it continues to go down. That 50 to 64 age group is 34%, 34.5, down to 20 to 49, which is 17%, and it continues to decrease, and of course does not apply to the 5 to 11-year-olds. And so when we look to the 12 to 17-year-olds, it's at 1.7%, right? So those who become eligible, right, they have to be 6 months post completion of their series. We want to see that increase while the schools are doing a fabulous job. And there are really minimal cases in our schools, relatively speaking. We really want to monitor that. And then when we look at the congregate living, again, just making sure that we make the vaccines as easily accessible as possible.
Any last questions, Jacob? I don't know if we lost him again or not. We cannot hear you, Jacob.
As far as
you're breaking up, Jacob.
Sorry, we can't. Okay. Okay. Just as far as the symptom, if more people to get it overall, can you hear me again? Okay. I've got. Okay. Oh, okay. I'm just going to drop out here. I've got enough for a story.
Okay. If you'd like to email me any further questions you have, we can pass them on to the folks here and get answers for you. So anyway, thank you both for joining us, and thank you for our participants and taking time out during this holiday season. And this conference has been recorded. We'll post it on our county website, and send you the link so you can share with anyone who be interested in watching. So again, thank you everybody for taking part, and have a good new year.
Yeah, Happy New Year, everybody. Thank you.
Thank you.